Margo sagittalis. This is Margo sagittalis. So just below Margo sagittalis will be sulcus sinus sagittalis superior, and all the small sulcuses are sulci arteriosi. Let's go with the sulcus again. Just behind this is angulus spinoidalis. This is angulus mastoidea. Angulus mastoidea ke little bit up you'll get sulcus sinus sigmoidea. Below Margo sagittalis you will get sulcus sinus sagittalis superior, and all the small sulcis are sulci arteriosi. This is fascius interna. Fascius externa, tuber parietale. But in this parietale bone you will have two lines of temporal bones which passes like this. Linea temporal superior, linea temporal inferior, and then this angulus spinoidalis ke just opposite, either there will be a foramen, like fully diagonal. Here there should be a foramen, which is foramen parietale, and this head part is tuber parietale. That's it. Done. This is the foramen obturatum. Okay, this whole thing obturatum names will come. This is sulcus obturatum. Okay, this sulcus obturatum. This is foramen obturatum. And then you get two processes. Listen, posterior is this side, so then there is tuberculum here, tuberculum obturatus posterior, and here comes tuberculum obturatum anterior, tuberculum obturatum posterior, tuberculum obturatum anterior, foramen obturatus, sulcus obturatus, and here this is crista obturatorius, foramen obturatus, tuberculum obturatus posterior anterior, crista obturatus, sulcus obturatus. This is done with here. Let's do the four ramuses. Ramus. This is pubis. This is ischia. Ramus superior ossis ischia, ramus inferior ossis ischia, ramus superior ossis pubis, ramus inferior ossis pubis. Okay, now listen to this rule. Here is this is pubis, so tuberculum. No, wait. Let's do the fascius symphysialis. It's broken, but there's a surface. Fascius symphysialis. Here one process will be coming that is known as crista pubis. Fascius symphysialis, which is broken over here. Wait a second. Yep, this fascius symphysialis. Above that you'll get crista pubis, which is fully broken, like this. You'll get one thingy like this. It would be like this. Crista pubis. That's the crista pubis. We are done with the frontal surface. Let's go to the back. Now in the back, this is the acetabulum. Okay, just above the acetabulum, you'll be having fascius glutinea, because glutinea are as muscles, and this is where the as muscles are connected. Fascius glutinea, and now you have three layers. As we know, this is the glutinea area. So here one linea will come, here one linea will come, and here one linea will come. 1, 2, 3. This will be linea glutea anterior, linea glutea posterior, linea glutea inferior. And now there will be two labiums on the above surface and one linea. The internal one will be labium externum, because this labium is being seen from this surface. So from this POV, this will become externum, this will become internum. But when we are labeling, we label from behind. So this will be labium externum, labium internum, dividing, then the inner one will be linea intermedia. Okay, so now let's revise all the four lineas and the labiums. Labium externum, labium internum, linea intermedia, linea anterior glutea, linea posterior glutinea, and linea inferior, fascius glutinea. And then there's a tuberculum over here, as this we know, ilia. There will be a tuberculum present over here. That's name is tuberculum iliacum. That's it. We are done with ileum. Now we know this is acetabulum. Normal common names: incisura acetabuli, fossa acetabuli, limbus. This thing looks like a limbo. like a lemon. So limbus acetabuli, and above, just above this, below fasces glutinea and above acetabulum, you get a sulcus. So that is sulcus supraacetobularis, because it's above acetabulum. So sulcus supraacetobularis, limbus acetabularis, sulcus acetabularis, incisura acetabularis, fossa acetabularis, acetabulum, and now lunata. Lunata is moon, and surface is fascius. See from here. This looks like a moon. So this is fascius lunata, fascius moon, surface of the moon. Fascius lunata, acetabulum. Acetabulum is everything. Fossa acetabuli, incisura acetabulum, sulcus supraacetobularis, limbus acetabuli. This outer covering is. And now one more thing to remember. Now two things to remember as per the rule. This we know this is pubis. This is ishi. So pubis has many profits. I don't know why. It has, when you call it the tuberculum of pubis, it's full tuberculum pubicum. But when you call tuber of ishi, it's just tuber ishidicum. And the back surface of pubis has 2 ramuses, whereas the back surface of ishi has only 1 ramus. Let's start. This tuberculum you see is tuberculum pubicum. This is tuber ishidicum. See, tuberculum, full name is given to P, but half name is given to ishidicum. Tuberculum pubicum, ishidicum, tuber ishidicum, and 2 ramuses. 1 ramus comes here, ramus superior ossis pubis, ramus inferior ossis. Ramus superior ossis pubis, ramus inferior ossis pubis, and ramus ossis ishi. That's it. So many profits like tuberculum, tuberculum pubicum, tuber ishidicum, 2 ramuses, ramus superior ossis pubis, ramus inferior ossis pubis. But whereas for this only 1 ramus, that is ramus ossis ishidicum. And now just below the fasces auricularis, we have 2 incisuras and 1 spina. All are of the same part of ischiadicum. How to remember? This is incisura ischiadicum major, incisura ischiadicum minor, spina ischiadicum. So this spina ischiadicum divides both the layers. So therefore we get 2 incisuras. This is incisura ischiadicum major. Now when it's coming below, it's divided by spina ischiadica, and in the incisura ischiadica minor is formed. So incisura ischiadica major, incisura ischiadica minor, between you get spina ischiadica. That's it. This is always Coxae. This is the front view. How to identify if this is the left or the right. If this thing ear type, this is fasces auricularis. So if this ear type thingy is in the left, then it's your left OS Coxae. OS Coxae, that is the hip bone. Let's start. There are 3 parts. One is ili, ishi, pubis. How to identify? Sometimes it's confusing. Ili is continued into pubis. It's continued into pubis. So this is pubis. See, ili gets continued into pubis, and opposite to that is ishi. Now, how to identify which is posterior side, which is anterior side? This is pubis. P. So opposite to pubis. Once you have identified which is pubis, you can opposite to that is posterior side. P cross P. So this is pubis. Opposite to that is posterior side. Now let's start with the namings. Acetabuli, this is ili, so this is os ili, alla fossa ili, alla os ili, or this is the wing of the ili, this is the crista ili, and then there is tuberositas ili, and then there are ili, there are 4 spina of iliaca. One is iliaca superior,